Dr. Jack Kucheran. I'm a chiropractor, and I practice locally here in Calgary. In fact, I'm up in the Northeast. White is a patient of mine, and we got talking about this, and I explained to him that I was going into different companies. We've been to Sears Canada, I've been to Scotia McLeod. Where was the last one we did, Carolyn?
G&E.
Yeah, GE, you know, so some different companies, and so it's gone over very well. So basically, that's what we're here today to do then, is to give you guys a presentation on stress. Because bottom line, how many people have stress in their life?
How many don't?
You know what? I'm glad everybody put up their hand, because you know what? If you don't have stress in your life, you're actually dead. You are. You're 6 feet under the ground, because you know, just to stand here is stressful, because you got gravity pulling you down all the time. It's a constant stress on our body, and so what happens is by the time you're 80, everything's touching the floor, right? So.
Okay. Seeing those pictures on Google.
Right, so everybody has stress, right? And so my presentation is entitled How to Maximize Energy and Minimize Stress. And so that's what we're going to talk about today. And so basically my objectives to identify what stress is, how do we get it, what does it do to our bodies, how does stress cause illness and disease, how can we actually measure its impact on our health, because that's a hard thing to do. How do we get rid of it? And at the end, we have a special gift for you, okay? So I want to talk about this word first. And the reason I want to talk about this word is because it's a word that gets so many of us into trouble. Because what we usually do is we wait until we have these before we do anything about our health, right? And so can anybody here give me a definition of the word symptom?
My back hurts.
Do you know what? That's okay, I agree with you, but you know what? That's an actual symptom.
Yeah, I guess it is.
That's an actual symptom. That doesn't define the word, though. Can you give me a definition of the word?
Result of an effect.
Yeah, exactly. What it is, and I'm going to put it in simpler terms, because that's, are you an engineer? I can't. Oh, what's happening to my, oh, hang on. Something happened. Do you want to let the following program to make changes? No, I don't want to do that. Okay.
Not now.
Not now. You bug me. Don't you like these little pop-ups? Anyway, what a symptom is actually a warning signal, right? What it is your body's way of trying to tell you that something's wrong, right? And the problem with symptoms is they only appear after the body has already reached a state of disease or a state of crisis, right? Well, what's the problem with that? Well, the problem with that is that by the time you actually have the symptoms, guess what? You've got the disease, right? And in some cases, it could actually literally cost you your life, right? So do you think it's a good idea to wait for symptoms to occur before you start to look after your health? Do you know what? It's probably not a good idea, right? And so it's like basically brushing your teeth after you already find out that you got a cavity. Not a good idea, right? Okay, so what do we usually want when we have symptoms like pain, headaches, back pain, digestive disorders? What is it we want?
Medication.
Relief.
Okay, we want relief. And what does that look like for the most part for most people? You just said.
Yeah, it's outdated, but I have two T22s.
Drugs, medication.
Done.
Right? I mean, that's what we usually resort to in our North American society, because that's kind of what we've been raised into that system to basically do. So basically, what's wrong with that mindset? Can anybody tell me that?
We're not curing the problem.
Exactly. It doesn't address the cause, okay, in most cases. So if you do have symptoms, what do you want to do? Do you just want to hide the symptoms and cover up the problem? Anybody think that's a good idea? Okay.
I think most people do that
You're right.
because they're scared of finding out what the problem is.
Yeah. Oops, we've got somebody. Oh, it gets these going. Or you're absolutely right. You know.
Nobody was.
Okay. It was just someone looking in the door, maybe. Okay. So basically, you're right. I mean, sometimes we're scared. We don't want to do that. But you know, it's an easy way out, isn't it?
Mm-hmm.
Right? Instead of actually getting to the problem or cause. Right? It's an easy way. Right? It's you know what? Everything in North America, by the way, is fast now. You know, fast food, fast cars, fast, you name it. Fast computers, you know, faster phones now, you know, all that. Everybody wants everything now, right? In fact, our government is a disease of our society, because you look at our government, okay, which may be changing from what I just heard on the radio today. But anyway, You look at our governments, and you know, no one plans for 5 or 10 years down the road. It's like day to day. It's like they govern from crisis to crisis. It's kind of sad. Anyway, we won't go there, that's politics. I'm not here to talk about politics, right? Does being symptom-free mean you're healthy?
No.
No, you're right, absolutely not. Because health actually has nothing to do with how you feel or with being symptom-free. After all, do you feel high blood pressure? Do you feel a tumor when it just starts to grow? Do you feel calcium deficiency? Do you feel any of those things? Do you know what? You don't, okay? So really, health has nothing to do with how you feel. And so we need to talk about sick care versus health care. Because when you wake up in the morning and you feel great, you're full of energy, fully alive, you know, ready to take on the day, do you think to yourself, gee, I should call my medical doctor? Yeah, you don't usually think that, do you? When do you call your medical doctor? When you're sick, right? And although sick care and health care, or sick care rather, is a very important part of our society, right? It's an important service to our society, so you know we still need it. It has nothing to do really with health care, okay? And so we've got to define what health is. Health is a state of optimal physical, chemical, and emotional well-being, not merely absence of disease, infirmity, or symptoms. And we already talked about that just because you feel good doesn't mean you're healthy, right? Now, health is a state of optimal, what I call the chiropractic F word. And it's not that short for it of the swear word you hear all the time, right? Okay? It's all about function. It's when every organ, every tissue, every cell, your mind, your body are functioning at their optimal level, or at 100%, right? And so that's what it's all about. Because you see, only when that's happening in your body can you actually live up to your full human potential in life and fulfill your purpose for being here on this planet. And you know what? God's purpose for having you here on this planet, when you're functioning at that optimal level. Does that make sense? Right. And so we need to talk about feeling versus function. So if you had a garbage dump and it was full of rats, and you wanted to get rid of the rats, well, you got 2 ways of doing that. You can throw poison and traps, right, into the dump. Or what's the other way?
Get rid of the garbage.
Yeah, get rid of the garbage. You see, and what medicine tends to do, and I'm not saying they do this all the time, but the tendency is to throw poison into the dump, or pills, you know, at the problem, without actually, you know, getting rid of the cause. And myself, as a wellness care provider, my goal is actually not to just treat the symptom, but get to the cause, so I get rid of the garbage, okay? Now, how big of a problem is stress? Well, American Institute of Stress in Yonkers, New York estimates that, get this, 90% of all visits to doctors are for stress-related disorders. In 1996, 75% of the population has experienced frequent and great stress. Researchers currently estimate that number to be around 90%. The World Health Organization actually describes stress as a worldwide epidemic, okay? So the consequences of stress on your health and your life, do you know what? They're absolutely devastating. Now, you're probably thinking, oh, what does he mean by that? Well, I'm going to explain that. How much so? Well, you just look at this slide. Here's only some of the long-term effects of stress. So this is an all-inclusive list. High blood pressure, depression, skin problems, headaches, back pain, insomnia, digestive disorders, heart disease, and stroke. How many people think it'd be pretty devastating to have a heart attack or a stroke? Do you think that'd be devastating? Do you know what? It would change your life forever. All right? It's devastating. Okay? So, here's some statistics. American Medical Association stated that stress was the cause of 80 to 85% of all human illness and disease. That's pretty high, if you think about it. Every week, 95 million North Americans suffer some kind of stress-related symptom for which they take medication. American businesses lose an estimated $200 billion to $300 billion per year because of stress, and in Canada, it's about $12 billion, okay? So it's expensive, all right? So we're going to talk about stress. There's 3 types of stress that I want to talk about. The first type starts with a P. What is it?
Physical.
Physical. And these are the 3 major categories of stress. So yes, very good. Physical. E.
Environmental.
Emotional.
I just said
But
that.
you know what?
I just said that because it's the first thing that came to my mind.
But you know what? What about the next one? Because this applies to yours. It starts with a C, but can you make the connection?
Coral.
It's not coral.
Coral would be in there, Bob.
Coral.
That's what I said.
Yeah. Coral has caused so much stress in this world. I mean, I don't know why they're doing business. Anyway, it's C. Any idea? It's close to what you said.
It is, environmental or
Chemical
chemical?
or biochemical stress.
All right.
Okay, so those are the three major.
Environmental and chemical, or?
We'll show you in a minute.
Really?
We'll get there, okay? So, we're gonna talk about physical stress first. What do you think the very first physical stress you ever had was? What is it?
Being born.
Absolutely. Anybody recognize these? They're called forceps. Now, maybe you don't, maybe you didn't recognize them when you were born, but anyway, how many people think they still use these nowadays?
I don't think they do.
They do?
Do they?
Do you guys have forceps? Okay. Vacuum? Oh, okay, well, guess what?
There you go. No, my kids were, not me.
They were sucked out with a Hoover. My third daughter had to have vacuum distraction because she was what we call a brow presentation instead of an occiput. And when the baby's head is brow presentation, there's a wider diameter, so she didn't quite turn enough. And so guess what? They did the old vacuum. This is a slide, and it shows a doctor delivering a baby, and he's got the baby's head severely rotated to the right, and he's pulling to get the baby out of the birth canal. Now, this is interesting, because you see this 80 pounds up here? Well, that represents all of the force that's required to cause severe, if not fatal, injury to that child due to excessive traction forces on the spinal cord and the brainstem. In fact, up until Dr. Tobin, who was a Harvard-trained medical neuropathologist, did this research, we had no idea. Sorry, am I in your way? Try to back up a little bit. We had no idea what caused sudden infant death syndrome. So he did a research study. He autopsied basically 8 children that had died from SIDS. He found that 7 out of 8 of them died from spinal injury with neurovascular complications sustained during the birth process, right? So guess what? Being born is traumatic. There's another research study done by a guy named Gutmann in Germany, and they found that 85% of children have damage to the cervical spine from being born, normal deliveries. Okay, it's pretty high. Okay? Other stresses, physical stresses, automobile accidents, studies show whiplash injuries can result from a collision of only 5 miles per hour, while an impact of at least 15 is needed to reveal any visible damage to your vehicle. Anybody have any idea why that is? Do you have any idea? Anybody engineers in here? Okay. Do you know why? Vehicles are designed nowadays with crumple zones. So what happens at a certain speed of impact, the vehicle collapses. So what happens, the force of that impact isn't pushed into the occupant, right? It's absorbed by the force of the vehicle collapsing. And so what happens is it's good for you. At certain speeds of accidents below the impact that it takes to crumple that vehicle, all of the force is being transmitted into you. So studies show that a whiplash injury of 5, 10, 15 miles an hour can actually cause some significant soft tissue injury. Does that make sense? Mm-hmm. Okay. Anybody been in a car accident here? Okay. All right. You have problems with it? Yeah. You know what it can do to you. Other physical stresses: overuse, repetitive motions, carrying a child in one hip, purse on one shoulder, phone in one ear, jogging, tennis, other sports. Why would jogging be a stress to your body?
Repetitive.
Impact. Okay. Repetitive. Lifting with the low back, not the knees, sitting on the wallet, computer work, poor ergonomics. Now, how many people in this room do that every day? Or some of these, right? I mean, probably every one of you, or have done this in the past, right? So those are physical stresses on your body. I'll bet you didn't think lack of physical exercise was a stress. We're actually designed to be moving. We're not designed to be sitting at computers or on desks all day long, okay? And they estimate that children should have at least 60 minutes of physical exercise every day, okay? I love this quote by George Bernard Shaw: "We don't stop playing because we grow old. We grow old because we stop playing." So guys, keep playing, all right? Because it'll save your life, okay? And he doesn't, and I'm gonna explain why. Because he didn't, when he wrote this, he had no idea how literal what he wrote would be, okay? And I'll explain why in a minute, and as to how it relates through the nervous system. So, how many people know know about tires? Okay, you know about tires? Okay, so which of these would you prefer for your spine, the one on the left or the one on the right, where it's so far out of alignment that that's what it does to you on the inside. And you have to start thinking of your spine the same way as you think about your tires or the alignment in your car, right? And so that leads us to the next thing we want to talk about, which is alignment or posture, okay? And so basically, you'll notice normal posture on the left. This lady's looking straight ahead. You'll see the opening of the ear lines up with the shoulder, which should line up with the hip, which should line up with the ankle. And so when the spine is in that alignment, you'll notice here, this black line, that represents the what we call a forward, looks like a C curve in the neck, okay? We want to see that, okay? That's good posture, okay? You'll notice here on the right, with the head shifted forward 2 or 3 inches, what happens is this opening doesn't line up with the shoulder, and you'll notice that the spine has straightened, okay? Now, I want to do something, and I know we're a little bit restricted for room, but I kind of wanted you guys to check some postures. Are you guys okay with that, or do you want to, it's up to you. Because what I was going to have you do is pair off, and I wanted one person to be a patient, one person to be the doctor, and I wanted you to do 2 things. I want you to stand, like the patient, stand and have the doctor look at you from front on, and I want you to observe if the head is straight, or if it's turned, or maybe tilted to one side, or if a shoulder's higher on one side or the other. Then the other thing I wanted you to do is I wanted you to look at the person with the opening of the ear to see if it lines up with the shoulder, and even more important than that, to see if the shoulder and the ear line up with the hip, or if they're both forward, because that can happen too. That's still abnormal posture. Do you guys want to do that? Do you think we have enough room? Okay, it just gives you a little tool that you can actually do this on your kids. You can check your kids or your spouses or whatever.
Don't even know.
Okay.
Okay.
It doesn't matter unless you're
She's
more
good.
evenly on one side.
You can do this.
Actually, it is better.
Yeah, I'm good too. I go to chiropractor every week.
No, look straight.
Yours is lined when
No,
you're
wait,
sitting.
look straight. Okay.
Yours is lined up when you're sitting.
Now you're going like this. Oh, you're supposed to stay straight.
Yeah. I can't because it's not.
No, it's okay. It's okay. You got enough room.
No, I don't. There you go. Okay.
So your ear
Yeah,
is
you're
not
standing up
lined
straight.
up
Yeah.
with the
Okay,
shoulder.
who's good? You do.
From what I can tell, nothing.
Yeah, now what you,
Usually.
yeah, oh, sorry, I want you guys to stand your normal posture.
Just
Because
your
you were
normal,
checking
yeah.
it, I don't want you all of a sudden going like this if you don't go like that. I want you to go like
You know what I see?
Yeah.
Normal posture. I see that this shoulder is lower on this side than. Right. So how about me now? No, I'm just gonna, okay.
You just kind of actually do
I'm
this.
loose. Straight.
Shake it loose.
That one's a little lower.
Ah, okay, okay.
That's what I
Okay.
say.
Okay, now, yeah, you guys can switch to each other.
It's pretty close.
Really?
Yeah.
Okay.
You're lucky.
Wow. You're in pretty darn good shape.
Just gonna remember to bring this one up a little bit.
Yeah, yeah. Next time I talk to somebody, I'll go.
Oh, sure.
It's my ear. If I stick my finger in your ear, do you want it?
What did you see on it?
I
Yeah,
believe
she's
you.
got a full.
The difference between Ashley and Michelle is because every the girls would be the chiropractor. And Ashley always had to come in extra times because she always just
Yeah.
Michelle, every time she sits down, it doesn't matter. She does this. And does
Oh, this is,
you know? And he's like, oh, I don't have to fix you, I have to fix her.
Right.
I'm cricket.
Oh, you want?
We're done. Okay.
You're is it right? Yeah? Okay, now I have a question. Anybody see any abnormal posture patterns?
Yes.
Did you guys see? Most of you? Put up your hand, I wanna see how many. Okay, so you know what, about what, 80% of you? And that's pretty common, we see that all the time. And you see, here's the problem with our society. We live in what we call a flexor-dominant society, where everything we do is in front of us, right? So if you're working at desks, you're on computers, you're bent forward, writing, whatever. Maybe you're an electrician, you work with your stuff in front of you, or a plumber, you know what I mean? All of what we do is forward-based. And so what happens, we develop these abnormal posture patterns, which eventually can lead to pain syndromes, okay? Now, I want to show you long-term the effects of what this does to you. And basically, I'm just going to show you the next slide here. And so what we know is when the spine is in its normal alignment and you've got the head in line with the shoulders, nice forward C curve, it takes approximately 12 pounds of muscle contraction force to hold your head on top of your shoulders so it doesn't roll off onto the floor. Okay? Now, we also know from research, and this comes from physiology of the joints, for every inch of forward head posture, okay, it actually doubles the amount of contractile force necessary to hold your head in place. Okay? So you think about that. Okay? If you work at a desk, okay, and you're bent forward, say 3 inches, well, normally, what is it, 12 pounds I said? Well, 1 inch forward is 24, 2 inches is 36, 3 inches is 48 pounds of force. Right? Now think about that. You do that 6, 7, 8 hours a day, you do that 5 days a week, you do that for the next 20, 30, 40 years, what do you think that's going to do to your spine? What do you think it's going to do? What?
Pull it forward.
Yeah, absolutely. But you know what? It's going to start to damage your spine. And I want to show you how that happens and explain to you how that happens with an x-ray. But before we do that, I'm going to get a show of hands. How many people think the one on the left is the healthier? Put up your hand if you think that one is healthier. Okay. All right. Anybody on the right? Anybody? How many don't know? Okay, you know what? You guys that said the first one is right. Because remember we said the forward C curve? See that? See how straight this one is? You understand that? Okay. Now, I want to show you why this is no good, the one on the right. Okay? Basically, and I'll explain this first. Okay, remember we said there was extra force pushing down on the spine. So what happens if you've got an extra 40, 50 pounds of force pushing down on your spine, normally when the spine is in this position, the coefficient of friction on the joint is like ice sliding on ice, right? It's very slippery. And so what happens is and this applies to any joint basically, if you've got good alignment in that joint and normal muscle tone around that joint, basically it's virtually impossible to develop arthritis in that joint. We also know with this type of a change, biomechanically, that extra force, does it make sense there's more friction on the joint? That does make sense, doesn't it? And so what happens, the joint will start to grind. And the analogy I like to use, it's like a sliding screen door. What happens is, you know, it starts to get sticky, hard to move. Maybe the bearings are going, it starts to grind. Finally, you know, man, you know, it takes all your weight to get it moving. You get so mad, you kick it, and it pops off the track, right? Well, your innate intelligence, in other words, what's in here, doesn't want to allow your vertebrae to pop off the track, because you know what? That would actually sever your spinal cord. And that's not usually a very good thing, right? So what your body does, it'll try to stabilize that area. How does it do that? Well, see this here? These are bone spurs, okay? Now you'll notice here nice healthy disc spaces, or these spaces between the bones. You'll notice that these ones here are actually thinning and degenerating. So the discs are degenerating, the joint becomes unstable, there's loss of movement in this joint, that's why this process begins to happen. And what happens, your body will form calcium deposits on the edges where the ligaments attach. These will eventually grow together at the front and back, and it'll fuse the spine. Right? So that's the process that goes on. Now, I want to read this to you, because this comes from the Mayo Clinic. Okay? Now, this is only one research study. Okay? You okay? Right. Anterior head syndrome, which is what this is, leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. You know what this is? This is called degenerative joint disease, degenerative disc disease, subluxation, degeneration, arthritis, and osteoarthritis. All those words mean the same thing. The problem with this is actually recognizable sometimes decades early in a person, but because guess what? They had no symptoms, they had no pain, they didn't do anything about it because they didn't know what was going on, right? But it's still happening, right? And so I see this time and time and time again in my practice, okay? Now, the reason this is so bad is because of the damage that occurs to the spine itself, okay, for one, okay? But the other thing that happens, because you know what? You start looking like this, right? That's not good posture, you know, not very good. Okay, so the structure of the spine starts to change. But the two other things that are even more important is what it does to the spinal cord in the back, okay? And I'm going to read you this study, okay? Loss of the cervical curve in the neck stretches the spinal cord 5 to 7 centimeters and causes disease. This is Dr. Elf Brigg. He was a neurosurgeon. He got a Nobel Prize for that research. Okay? So what happens is it tractions your cord. Now, we know that from other research studies, a 6% stretch on a nerve will diminish its nerve function by up to 70%. How many people think it'd be a good idea to have only maybe 30% of your normal nerve supply going to your liver or your kidneys, or your stomach, or your heart. You think that's a good idea? Not a good idea. So guess what? Those organs and tissues will start to break down. Now, that's not, well, that's bad. But I mean, the next bad part is what happens because we get changes in movement patterns in here. We actually decrease something called afferentation to the brain, which means signals going up into the brain. And I'm going to explain this in a minute. I'm going to come back to this. But what happens is basically, it changes our brain. Okay? Literally changes our brain. And so it damages your brain and your spinal cord and all this stuff. So this is not good stuff. Okay? So, ergonomics. We talked about posture. Sitting. We're going to come to a slide on that. Lifting. I know you guys, well, you guys look like primarily office workers, but you probably have crews. You've got crews that go out and do a lot of heavy work. But lifting, I want to go over that with you briefly, okay, because maybe you do some lifting at home. Make sure when you're going to lift something, you size up your load, okay? And if it's too big, get help right off the bat, okay? If you think you can handle it, then basically you want to use your legs like this, not your back like that, okay? And you want to center the load. You want to get as close as you can, keep it in close to you. Okay, because it acts as a lever. Okay, out here, you got a lot more muscle strain going to occur in the back. And then once you get it up, where your nose goes, your toes go. Okay, so don't twist with it, right? That's how a lot of injuries occur. Stretching. You should warm up. If you guys, I don't know how many of you do exercise programs, but you should be doing exercise programs, but you should warm up before you do your stretching. Because if you try to stretch cold muscles, you can actually injure yourself. Right? So what I mean by warm up, get on a treadmill for 5 or 10 minutes, or just jog on the spot, whatever. Warm them up, then you can stretch, and that'll actually help prevent injuries. Exercise breaks, and of course, I'm going to talk about stress reduction exercises in this one because that's what we're here talking about, stress, right? So I want everybody to participate in this with me again. Okay, this is called participation, right? So everybody stand up. Okay, and we're going to do what we call reverse shoulder rolls, and so I'm going to show you how to do this first. And then I want everybody to do this with me after, okay, a few times, okay? So what we do is we want to breathe in, and then as we breathe in, we're going to roll our shoulders up and back as far as we can go, hold our breath, approximately 5 seconds, and then breathe out. So it looks like this. I'll show you the first time. Okay? In through our nose, out through our mouth. So I want everybody to do this with me about 4 or 5 times, okay? And there's a reason. So let's go ahead and do this. Ready? Breathe in. Okay, again. 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 Getting kind of bored? This is the last one. Now roll your shoulders a bit, kind of turn your head, move your head a little bit. Okay, how do you feel? Good.
Lightheaded?
Yeah. You know why? You increase your oxygen in your body,
Yep.
okay? And what you did, you also relaxed some of the tension in through these muscles. A lot of people are on computers, that's where they get it, in these back muscles. And so you do that every 30 minutes, okay? Now, how long does that take you? 30 seconds, 5 seconds, 6 times in a row. And then, do it every 30 minutes. So you might say, oh, it takes too much time. I'm too busy. Well, you know what? 1 minute out of every hour. What that does is it breaks up the tension in your body, and it actually increases your oxygen. It picks your brain up a little bit. You'll actually be able to concentrate better. You'll be more productive. You'll actually get more work done, okay? So just try and do a little stretch break. It's a good one. Now, one other one I want to show you, and it's breathing. And you know what? I read different things on this, but actually there was a doctor on Dr. Oz. You guys know who Dr. Oz is. And he's into breathing, right? And so what he said is we should breathe in through our nose for 4 seconds, and then hold for 7, and then breathe out 8. Okay, so we double our time breathing out as we breathe in. Okay, so I'm just going to show you that. So through the nose. So what happens, we should do that about 10 times in a row, okay? And you do that, if you're ever stressed and you do that 10 times in a row, I'll tell you, it just melts your stress away. You just feel like putty, okay? It feels really good. And you're increasing your oxygen levels in your body. One thing by doing that, you actually change the pH of your blood, okay, to a more basic pH. Your nerves work better in that environment and in an acidic environment, okay? It has to do with regulation of the membranes across the nerve cell membranes, sodium and calcium and all this stuff. Anyway, we won't get into that. Okay, so that's an exercise you guys can do. You can have a seat there. And so, home activities. If you guys are doing this, stop it. Because you know what? It's killing you, all right? Sleeping. This is a good posture. Side posture, head neutral. These aren't so good. Next best position on your back, okay? So those are good positions, okay? Putting it all together. Now you guys have this handout, so I won't go into detail about this other than it gives you a basic pattern, and everything on here is in there of how you should set up your workstation. So it's something that you should look at, when, at your computer station there if you're sitting. So we talked about a lot of stuff in physical stress, isn't there? Okay. So I want to talk about emotional stress now, and what I want to talk about is the four. There's so many things here too, but the four biggest things that will ever cause you emotional stress in your life. They are, in order, number 1, death or loss of a loved one. Number 2, divorce or separation. Number 3, moving. Number 4, being too serious. Now, do you guys, are you into movies?
Yeah.
Do you remember The Dark Knight? Anybody see that movie?
Yes.
Remember Heath Ledger?
Why so serious?
Did you hear that? Why so serious, right? Okay, so anyway, being too serious can cause you great stress. In fact, do you ever know anybody that suffers from depression? Okay. Have you ever noticed that those people get sick more often? Have you ever noticed that? Okay. Well, why is that? Because what happens, they're depressed, they're negative emotions, and it actually, I'm going to talk about why this does this in a minute. It suppresses their immune system. They're sick more often. Whereas people that are upbeat and, just full of life, they just don't get sick as often, right? They're positive. Okay, why is that? Because of this, cortisol. It's the stress hormone. And so what happens when we're under stress, our bodies produce cortisol. And basically what that does, it does a lot of things to us. But basically, it causes our bodies to be stuck in this fight or flight syndrome. And the fight or flight syndrome is actually a great response, okay? Because it's to save your life, okay? So maybe one day, a long, long time ago, you might have been out running around on the Serengeti Plains, chasing down a wildebeest to get your next meal, and all of a sudden, a saber-toothed tiger jumps out at you, right? Okay, so immediately you go into the fight or flight response, and so what happens is cortisol is produced as a result of that, and basically that hormone, along with our catecholamine hormones, activates our fight or flight response. And so all of a sudden, we got things like, we got free fatty acids, we got, glucose being dumped into our bloodstream so that we have rocket fuel and jet fuel and, to fight or flight, to save our lives. And it's a great response, okay? The problem is it was never meant to be stimulated chronically on an ongoing basis, and that's what happens in our society. We get in these high stress situations for years sometimes, okay? And the result of that is we get this stuff happening. And this is not an all-inclusive list, but things like chronically hypertonic muscles, increased risk of heart attack and strokes, by the way, decreased immune function, inability of the body to achieve homeostasis, that means balance, okay? Headaches caused by high blood pressure, not just blood pressure, but tension headaches too, even migraines, insomnia, anxiety, those are some of the effects of chronic fight or flight stress, okay? Nutritional or chemical stress, okay? And so basically, you got to have a little fun once in a while, right? Okay, so if you look at that slide, you can see what they're looking at. It's got to be an implant, eh? Are your lungs full of this? Okay, I don't know if you guys, any of you are smokers in this room. If you are, you know what, I'm not going to beat you over the head with that. You know it's not the best thing for you. But if you've got a friend that's a smoker and they're a chain smoker and all of a sudden they start to drool at the mouth and their speech becomes a little bit slurred and incoherent, you better take their cigarettes away and get them to the hospital because they got nicotine poisoning, okay? Oh. Now, aside from that, okay, other stressors, chemical stressors, are alcohol, things like drugs. I bet you didn't think that was a stressor on your body. It is. Perfumes, And pollution, industrial pollution, we said we'd get there, okay? So the air you breathe, the water you drink, do you know even the foods you eat, you know, processed, there's chemicals in those foods, right? Well, guess what? Those chemicals weren't designed to be in those foods. You know what our foods are designed? They're designed to grow out in the field and we go pick them, right? Or, you know, shoot them or whatever. We weren't meant to, you know, be having all these chemicals put into our bodies. And so, what's a commonly hidden chemical nutritional stress that we don't think about? There's 3 guesses I'll give you. There's 3 pictures, I'll give you 3 guesses. What is it? Pills, drugs, right? Do you realize that the pharmaceutical industry, basically, and this is in the year 2001, and this is the top 9 pharmaceutical companies, actually spent $45.2 billion on advertising and marketing, and only $19.1 billion on research and development. Do you guys find that just a little bit disturbing? You find that a bit disturbing? Yeah, I find that disturbing, right? I mean, those numbers should be reversed, right? But that's what's going on. And that was 10 years ago, right? We're not talking about now. It's even more, okay? And so just to show you how effective their marketing dollars are, I'm going to read these. You tell me what they are. Plop, plop, fizz, fizz. Yes. Nighttime sneezing, sniffling, so you can rest now. Yeah. How do you spell relief? Us older guys should know this one. Yeah.
What was it?
R-O, remember that commercial? R-O-L-A-I-D-S. Remember that now? Okay. What is the pink stuff? Right. What's the purple pill? That's a harder one.
Oh, that's that for indigestion, right?
Yeah. Prilosec, Nexium, those types of, they're called proton pump inhibitor drugs, right? What about the blue triangular pill for men?
I got it. I mean, whoops. Anybody know?
You guys all know that one, don't you?
Yeah.
Right? Do you realize I can tell you the name of, or sorry, the color or the shape of the drug, or both, and you guys can tell me what it is? It's pretty serious advertising, don't you think?
Mm-hmm.
Right. And so, remember this drug, Vioxx? It was actually, you don't?
No.
Okay, some of you might. It was actually pulled off the market in 2004, because you know what? It was killing people. 60,000 people died due to heart damage from this drug, okay? Now, what's really interesting, just recently, they put it back on the market.
Wow.
Now, do you know why? Do you have any idea? Yeah, same.
Using it for something different.
No.
Same.
Sometimes they do that, though.
Yeah.
But you know why in this case? They actually have now discovered that every non-steroidal anti-inflammatory drug out there, ibuprofen, Advil, all of those, even Tylenol, cause heart damage and can kill you. And the only one that doesn't, baby aspirin.
Mm-hmm.
Isn't that interesting? So guess what? Now we're just going ahead and killing people, more people again.
So now go take a handful of baby aspirin instead of a Tylenol and you'll be good.
I don't know about a handful. I don't think the study was talking. Yeah.
I think people are pretty rude if you're starting to steal drugs from kids.
There you go. I mean, leave them for the adults, right? You should be proud of me, Petey. I downloaded Vioxx the other day. That's Firefox, Grandpa Firefox. Doc, lately I've been feeling a little bit sluggish. You can see why he's starting to look a little bit sluggish. What is one of the common reasons for sluggishness? Guess what? Artificial sweeteners. You guys have to understand things like aspartame, sucrose. These are actually major neurotoxins in your body. Did you know that? They actually burn your nerves out. Okay? They're neurotransmitters. They affect the neurotransmitters in your brain. And so they can cause things like sluggishness, fatigue, heavy legs, mood swings, cramps, painful bowels. Guess what? Bet you didn't think drinking a can of this would do that. Okay? There's actually in your handouts, there's a paper on that. You can read it. Okay? Joint pain, diarrhea, tiredness, dizziness, confusion, bloating, formaldehyde. They can actually get broken down into formaldehyde in our bodies. So how many people would actually drink an ounce or two of formaldehyde every day? Would you do that? Yeah. And you know what? You might be thinking to yourself, well, gee, you know, I don't drink any of it, but I eat my, you know, chew my one piece of Trident sugarless gum every day. No big deal. Well, you know what? If you're doing that, you got to stop it because it's killing you. I mean, would you drink 3 drops of gasoline every day? It's the same thing, right? It's just death by 1,000. What is it? 1,000.
1,001 ways to die.
No, there's
Death
another
by
thing.
1,000 cuts.
1,000 cuts
Yeah.
instead of, you know, the one big one. Okay. I mean, I'm surprised the people that make this stuff can sleep with themselves at night because that's what's happening.
Is stevia okay?
Good question. Can you hold on for 2 slides?
You bet.
Don't overdo sugar either. Look at that.
Yay.
All of these could kill you. Okay, diabetes, that's a bad. Okay, all right. Healthy sweetener use guide. Avoid these guys on the right. You got this in your handouts. Okay, good ones. Stevia. Okay, and this. And if you're interested, if you're calorie counting, this one and these 2 have virtually no calories. The rest of these have more calories. Okay, but these ones at the top on the left are great for sweeteners, and they're safe. Okay, for you. Okay, so those are healthy sweeteners. So we talked about the 3 types of stress, but we didn't talk about how stress causes disease in our bodies. Well, it's through what we call the mind-body connection. Okay, and we're going to talk about that here now. Okay, so Dr. Hans Selye, considered the Einstein of medicine, suggested that disease is the body's inability to deal with mental, emotional, or physical stress. And so one surefire method for reducing stress, chiropractic care. Now, you're sitting here going, oh yeah, he's a chiropractor, he's going to say that. You know?
I didn't say I thought it.
Yeah, there you go. Well, before you can understand the connection between chiropractic care and stress reduction, you have to understand what system controls absolutely everything, all function in your body. And so what system controls everything in your body? What system?
Your brain.
Brain and
Nervous
Neuro.
system.
nervous system. So your nervous system is made up of your brain, your spinal cord, and 31 pairs of spinal nerves. That's your nervous system. And so your brain monitors every single cell, muscle, gland, organ, and system in your body by sending and receiving information via the spine. Every function of the human body is under the control of the nervous system. Its function is to coordinate all the other organs and structures and to relate the individual to his environment. That comes from Gray's Anatomy, not the show. Okay? Now, I've got a question. What controls your circulation? No,
Brain.
it's your brain, right? Your circulation is controlled by your brain. I mean, your heart has to be the pump, right? But it's like in you guys' industry, you guys probably have control centers for, you know, the valves or whatever that have to operate in your equipment, right? And so it's still your brain. Okay, now, or your nervous system. What controls your respiration? Your nervous system. What controls your circulation? Yeah, your nervous system. So is there anything that your nervous system doesn't control? Is there anything?
No.
No, absolutely everything's controlled by our nervous system. We literally live our lives through our nervous system. And so how does that happen? Well, you got 3 types of nerves that control the function of the body. Sensory nerves, motor nerves, and autonomic nerves. We're going to talk about these ones first. Sensory nerves tell your brain what's happening on the inside of your body and also what's happening in your environment. So if you go outside and it's 40 degrees above, how does your brain know it's hot?
Feeling.
Okay, you sense it, but how does it know? You got what? Sensory nerves. You got nerve endings in your skin, heat receptors that send signals to your brain to say, hey, it's hot. What if you interfered with the signals going to the brain so your brain didn't know it was hot? What do you think might happen to you?
You'd overheat.
You'd overheat. You could literally die, right, of hyperthermia or heat stroke, right? So those are important little nerves. Now, look at this. They only comprise 10% of the nervous system. Now, why is that important to know? Okay? Your brain gets hit with approximately 30 trillion bits of information every second. Only 50 bits of that is conscious. Pain is a conscious perception. Only 5 bits of that information is devoted to pain. Isn't it interesting that such a small part of that information hitting your brain gives you so much grief in your life, right? But that's the way it is, okay? And so, you know what happens? You can have, 99% of the time, you can have significant structural change and damage going on the inside, and you don't what? You don't feel it. You ever wondered why, someone can get cancer, and sometimes those tumors can take, believe it or not, 10 years to grow to the size where they're life-threatening, and the person goes into the doc says you got a tumor the size of a baseball in you, and you're dead in 6 weeks? You've heard of that, right? Well, how did that happen?
I understand, just recently and on topic, is it the University of Calgary or University of Alberta
Right.
have just found out, especially for women going through mammograms,
Right?
that they're able to see differences within now to detect a tumor starting to grow before it's actually growing? Or the way that
I'm gonna
the
address
cells
that.
are?
I'm gonna address that in a minute, because you're gonna find what I tell you very interesting. Because I'm gonna talk about that, okay? Not that particular study.
But breasts.
Uh,
Okay. I get it.
Cancer.
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 Okay.
All right, so motor nerves, they actually go to muscles. And so let's say you interfered with a nerve going to a muscle. What do you think is going to happen to the muscle?
It's gonna shrink.
You know what? Long term it does. It dies. It'll atrophy, right? Any organ or tissue that gets disconnected from your nervous system starts to die. You know that? You're either, you know what? You're either growing or you're dying. One or the other, okay? Even though you might feel like, you know, everything's constant and the same, it's not, okay? You're either, you know, you're improving in health or you're decreasing, okay? You're declining. And so if you cut the nerves long term, yeah, basically you could get atrophy and death of that muscle. Actually, they find if the muscle doesn't get reinnervated, the nerve growing back into it, within a year and a half, it's permanent, okay? Muscle will never come back, okay? You lose that control of that muscle, period. What happens with motor nerves, if you just interfere with it though, initially you'll get weakness in the muscle, okay? Autonomic nerves go to organs, blood vessels, and glands. So let's say you interfere with the nerve going to the heart that controls the heart. What do you think could happen? Well, that would be the end result of, you know, that could be a possible outcome. But well, you'll get functional heart conditions. So you might get high blood pressure, you might get low blood pressure, you might get bradycardia, tachycardia, that means fast or slow heart. You might get palpitations, and the worst outcome, you could die. Because in studies, they've actually shown unbalanced activation of a cardiac sympathetic nerve can stop your heart. It could kill you, right? And so that's why it's important to know about autonomic nerves. Okay, so what determines the body's ability to effectively deal with stress? The nervous system. And so our nervous system is responsible for processing and filtering all stresses that we're exposed to. Your nervous system literally remembers every single stress you've ever had in your entire life. And you might say, oh, come on, Dr. Jack, I don't buy that. I don't remember what happened to me when I was 4 or maybe 5 or 6. And you know what? You might not. But your nervous system does, okay? And I'm going to give you an example of that. Let's say at 4, 5, or 6 years old, you guys learned to ride a bike, okay? Well, you got on the bike, you fell, you got up, 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 you fell. You did that maybe a dozen or more times, and eventually you could ride that bike, yes? Absolutely. Now, what you did is you put a physical stress into your body, and it's your brain and your nervous system that had to change. Your brain and nervous system literally, physically and physiologically changed in order to adapt to that stressor so that you develop what I call healthy nerve pathways or nerve patterns so that you would get the strength, coordination, balance to be able to ride that bicycle. Does that make sense? Okay. Now let's say you stop riding that bike for 5 years. Then you go to get on it. Can you still ride it?
Yeah.
Do you know what? That was permanent. Because if it wasn't permanent, you have to learn it all over again. Does that make sense? So that's what I mean by the nervous system permanently changes and remembers every single stress you've ever had. Now, the ability of our nervous system then to adapt to stress will determine if we're able to maintain homeostasis, balance, or optimal function and health. So what then determines if stress will cause disease in our bodies? Well, it's that internal ability to adapt to that stress through your nervous system. I want you guys to understand that. That's the mechanism of action. So if your nervous system can meet the demands of the physical, emotional, and chemical stress that you're pouring into your life, guess what? You get to be healthy, right? You get to be healthy. If, on the other hand, the stresses that you're pouring into your life overwhelm your nervous system's internal ability to adapt to it, you develop what we call, I'm off the slide there, unhealthy neurologic patterns. Okay? This is actually a nerve scan. We're going to talk about this in a minute, so I won't get into this in detail. But just like you can develop healthy patterns, like riding that bicycle, you can develop unhealthy ones. See, that's where it all starts. It all starts here. Think about it. You've heard of people under high stress, they get ulcers. Yeah? Heard of that? How does that happen? How does stress cause an ulcer?
Worry.
Worry through
Mental.
the nervous system. That's the only way that can happen. Stress can't cause a thing on you. Can't cause heart attacks, can't cause high blood pressure, can't cause any of that stuff unless it's through your nervous system. Do you understand that? Very important for you to understand. Now, what is a subluxation? Did anybody know that? You heard of that name? Okay. I'm gonna read this to you. Basically, there's three components. There's an alteration, change, or disruption of the mental impulses causing unhealthy neurological patterns, interfering with the body's ability to express itself. Neural tissue, spinal cord, nerve roots, surrounding tissues or meninges are compromised, elongated, stretched, or have pressure put on them by the misaligned vertebrae, commonly called a pinched nerve. The spine is no longer moving through its normal range of motion and is considered misaligned. Remember we talked about that slide with the spine, you know, how it's straight, you know, and we talked about you'd lose function in the joint movement. There's no movement there when that thing starts to fuse. Does that make sense? Yeah. So why is that important to know? Well, this guy here, his name was Dr. Roger Sperry. He was a brain researcher. He was given the Nobel Peace Prize for this research, this particular piece of research. 90% of the stimulation and nutrition to the brain is generated by movement of the spine, which would be analogous to windmill generating electricity. I want to focus on that, okay? I'm actually, Boyd, you know about this, I'm taking courses right now towards a diplomate program, another degree in functional neurology, okay? And so I've been attending these different seminars. And I was at this one, and basically our presenter, he showed us a video presentation of this doctor. His name's Dr. Damasio, okay? He's a brain neurologist guy. He's written some books. He was lecturing to a class. And what he said is he actually said that our conscious awareness of who we are and what we are is determined by what he called a set point of activation in your brain. In other words, a certain level of activity going on in your brain. And that level of activity in your brain is based on neurological input from the somatic part of your body. That means the musculoskeletal part of your body, and 90% of it from the spine. Okay? And so how does that happen? Well, your spine has nerve endings in it, and basically they're in the joints, they're in the ligaments, the capsular ligaments, they're in the muscles that surround the joints, the muscle spindle fibers, all these little nerve endings that basically tell your brain where your body is in position, space, and time. So when I put my hand out here, my brain says my hand is in behind me, right? And I know that, right? Well, how does that happen? Well, all these little nerve endings are sending information to my brain about position, about motion, movement, acceleration of joint, angles in your joints, all this stuff, right? And that's how your brain knows where you are, okay? Otherwise you're lost, okay? And so what happens is that fires up through the spinal cord into the midbrain and the cerebellum and then into the cortex, the cerebrum, which is where you actually have your conscious thought and awareness. Now, the more activation you have, the higher level of activity in your brain, the healthier you are, okay? If you diminish that afferent input into the brain, you actually change the integration of information in your brain and you change your consciousness. Isn't that wild, right? It can change who you are, right? Or what, you know, your health states. And that's why this is so important to know about this, okay? Because, you see, your brain needs three things. It needs oxygen, glucose, and it needs activation and nutrition from the spine. And we're not taught about this stuff. We're taught about how exercise is good for our heart, our lungs, our muscles, which is great. And I agree with all that. It's really, really important. But no one teaches us, excuse me, why it's important to look after the spine, okay? Because you know what? Without a healthy spine, you do not have a healthy brain. If you don't have a healthy brain, you don't have a healthy body. That's the bottom line. Your brain is dependent on what's going on in your spine. Now, what's interesting, and I'm going to tell you, I'm going to share this with you because it was really cool what happened. I had a patient come in. She was referred in to me. She had schizophrenia, and she was referred in by a counselor. We started working with this young lady, and basically we did a wellness care program. On our 6 months into care, she says to me, Dr. Jack, she said, I'm like a different person. And I mean, no pun intended there, okay? but she said, before you started working on me, she said, my thoughts were always scattered, they were random, they were all over the place, I couldn't follow a logical train of thought or sequence of thoughts, and I couldn't remember anything. She said, since you've been working with me now, she said, I can follow a logical train of thought, a sequence, normal sequence of thought. She said, I remember almost everything I hear and read, and I don't have these random thoughts all over the place. And it changed her life. Now, how did that happen? All I did was adjustments on her spine. We were changing that neurological input. It was altering the way her brain was working, and it changed her consciousness. Wild, eh? But I've seen stuff like that in my practice. I've got a lady right now that I'm treating that had, well, seizures, and this particular lady was getting about one every 2 months. Now, she's been a patient for 3 years now, but just over the last 6 months, she hasn't had a seizure, okay? But it took 2 or 3 years, right, to get her, and her seizures were getting, you know, slightly longer between, but now she hasn't had it, right? So I see some of these things in my office, in my practice, okay? So it's really important for you to understand this, because you see, what happens is those nerves, by firing like that up into the brain, they keep your brain healthy, right? And so what happens if we diminish that input, if we have subluxation, if we have those straight spines, we get loss of motion, we get loss of activation of your brain. You know what happens to your brain? It shrinks. They've actually done research studies where they put people in cervical collars. They did functional MRIs before, and then they did them after, at intervals. They found within, get this, 2 to 3 weeks, the brain changed significantly. This is the before. You can see all these orange and blue areas where the brain's lighting up. That's where it's working. You can see this bottom one after 2 weeks, 3 weeks of wearing the collar. Very little activation. Look at the size of the brain. Wild. Okay? Crazy. Wild. Okay? That's why I'm teaching you guys this stuff. It's important to know. How do you know if you have nerve interference, subluxations, or nerve damage? 3 ways. Okay? Number 1, you don't. Why? Can't feel it. Remember we talked about that. You don't feel it. Number 2, you do feel it. But if you feel it, what have you got? Yeah.
Symptoms.
You got the symptom, and what else have you got? The disease, right? The problem, right? Number 3, you get nerve scans done. Now, I talked about those nerve scans. I said I was going to come back to it. This is a thermography scan. Basically, this is one of the scans that we do in our office to check autonomic nerve function. And so, here's a normal heat scan, green bars, balance. Here's an abnormal one with yellow, orange, and red bars. And so, you're probably saying, well, how come some of you, I don't know if you've been to a chiropractor that does this. If you have, great. If it wasn't explained, I'm explaining it to you, okay? But you're saying, well, how does it work? How do you know what's happening? You know, where's the research behind this? Well, here's the research, and there's other research. I've only got 2 slides on this because I got to get through a lot of material. But anyway, digital red imaging is an extremely sensitive, non-invasive, risk-free, and accepted diagnostic procedure that images the condition of the nervous system via the temperature of the skin. It's so sensitive, thermography, that you can actually literally detect breast cancer in a woman 10 years before she developed breast cancer. That's how sensitive it is, right? In fact, when they use thermography along with mammography, and maybe they got some new techniques, I haven't heard the study, with mammography, they increase specificity for detecting breast cancer in a woman by 300%, right? And you're probably saying to yourself, well, why don't they use this stuff? Well, Medicare doesn't pay for it. And radiologists don't do it. But I'm surprised a radiologist doesn't jump all over this, offer this service, because I've heard that it costs around $300 to $400 to have this done. And you know what? They can make a lot of money. I mean, what woman wouldn't want to do that? I'd pay $300 for that. Wouldn't you want to know? And I mean, if it can pick it up 10 years, you're ahead of the game. Right?
How new
You
is...
can actually save lives. Thermography's been around for a long, long time. This was actually 1986, 82. But, you know, it's been around for quite a while, okay? All right? And so these surface thermal patterns are a direct reflection of sympathetic sensory nerves control over the skin temperature. I want to explain that, because when we look at that graph, what we'll see you see bars? Remember the bars on the graph? Okay, well, on the opposite side of the bar, you see no bar. Okay, you see nothing, and then on one side, you'll see a bar. Well, what happens, as we roll that thing up your spine, we're checking, you've got a pair of nerve roots that come out from every level of your spine, right, going out to the rest of your body. So what happens is those are mixed nerves. That means that there's sensory, motor, autonomic nerves in there. One of the control mechanisms for your blood circulation is autonomic nerves going to the arteries, which makes them open and close. So if we roll this up your spine and we find a bar on this side and no bar here, that means the blood vessels on this side are constricted relative to the blood vessels on this side. Okay? Now here's the thing. It's not just happening at the spinal level, it's wherever that nerve goes. So if that nerve goes to your heart, how many people think it'd be a good idea to have decreased blood flow going to your heart? Not a very good idea. Okay, so that's the science behind it. Now, 3 secrets then to managing stress. The absolute key to eliminating the disease process from stress is how well we as individuals can manage the 3 types of stress. Secret number 1, managing external stress. Identifying incoming stress, past stress, and reducing or eliminating. On your handouts, right here on the back page, you guys have, there's a lot of stuff in here, but you guys have a paper that says I'm at risk for stress, okay? And this is actually from the Journal of Psychosomatic Research. You can go through this, you can grade yourself, and you'll either find your low, medium, or high susceptibility to stress-related disease. And then if you flip the page, on the other side it says what are the signs that you're under stress. And so you can go through that. If you're getting those things, and you're a high or medium risk for stress, do you know what you guys got to do? You got to take care of this, and you can't take care of this, oh, you know, I'll get to it a month down the road, or 6 months, or a year later. You got to do it now. Do you know why? Your life depends on it, okay? Because that's an indication that your physiology and your body is changing, okay? So that gives you a tool, all right? Secret number 2, increase your capacity, exercise, rest, nutrition, meditation, yoga, and prayer. Those are things that we can do to help our bodies and help ourselves be able to deal with stress better. So here's your tools: nerve supply, oxygen, exercise, water, nutrition. And so nervous system, well, we talked about this, nerve scans. You don't know you got problems unless you get your nerve scan. Posture checks, posture exercises, chiropractic adjustments to maintain the health of your spine, but more importantly, your nervous system and your brain. Remember I said you can't have a healthy brain without a healthy spine. It won't happen, right? And you can't have a healthy body without a healthy brain. Oxygen, breathing drills, cardiovascular exercise, muscle stretching, massage therapy, toning and strengthening. Nourishment, whole unprocessed foods, 6 to 9 fruits, servings of fruits and vegetables. Water, drink half your body weight in fluid ounces every day. So if you weigh 100 pounds, you're drinking 50 ounces of water.
Oh.
Got it? Okay. Secret 3, again, got to get your nerve scan to know if you have problems and begin a plan to balance your nervous system. This is a patient, I want to share this with you, that we worked with. And I'm going to explain this slide because green bars are normal, yellow is mild, pink is intense, and red is severe nerve interference. And you'll see she's kind of lit up like a Christmas tree. She only has 2 normal readings. And so just looking at this scan, I mean, how healthy do you think this person is, and what do you think her health potential is? I'm going to tell you her story because she came in to see me, and when she came into me, we did the scan on her, and she was diagnosed with cancer, okay? So she had cancer in her hips, in her ribs, and in her skull. She had bone cancer, and it was widespread. She'd been to the Baker Center. They took her, she was on HRT. They took her off the HRT, and that's all they did. They didn't treat her. They said, go home, get your affairs in order, because sometimes they do that.
What's
okay?
HRT, sorry?
Hormone replacement therapy,
Okay,
estrogen,
thank you.
progesterone
Thank you.
therapy, okay? And so basically that's what they said to her. And so she came into me, and I did 2 things with her. Number 1, I prayed for her. I think that was a good thing to do, okay? And number 2, we began a series of chiropractic wellness adjustments, like a plan to help her, okay? And so you might think, oh, how could a chiropractor help with cancer, right? Okay, I'm going to explain that, okay? Because what happens, experts say we produce our bodies 5,000 to 10,000 cancer cells every single day in our bodies. Have you ever read that? Anybody heard that? We've got cancer cells? All of us? Okay. Why aren't you going to the hospital every month and having tumors cut out of you? Why is that not happening? You know? What does your body do? It fights them. It destroys them. Do you know what system does that? Not your nervous system. Sorry?
Good guess.
Immune system. It's your immune system, which is controlled by your nervous system. Okay? And so basically, what happened, we started working with this lady. Okay? And this is her scan 3 years later.
Oh, wow.
2 things I got to point out. She's
She
still
made it
alive.
3 years, yeah.
She's still alive. And she'd been going back to the Baker Center every 6 months, and I'll explain what happened in a minute. Now you're going to say, well, you know, where's the research behind this? Well, you got a research paper in your handout. Dr. Perot, he's actually a cancer researcher. He's published 160 different articles in peer-reviewed journals. He actually discovered people with spinal cord injuries, much higher rates of cancer. So he did a study with chiropractors, and you know what he found? He found people under long-term chiropractic care, their immunocompetence, which is their activity level of the immune system, is, depending on which control group he studied, he compared them to rather, was 200 to 400% higher among people that got regular chiropractic wellness care adjustments. Now, over a period of time, and he said it of 6 months or more, okay? Your immune system is working at a much, much higher level. So anyway, getting back to my patient here, this is what she looked like when we did the scan 3 years later. She goes back to the Baker Center at this point in time, no cancer. It's gone, right?